Hello and welcome to the Cleveland Center for Eating Disorders three-part video blogging series on the diagnosis, management, and treatment of eating disorders. I'm sitting here with Dr. Lucene Wisniewski, our center's clinical director, who is going to discuss with us the empirically founded treatments for adults with eating disorders. Dr. Wisniewski, who makes up an eating disorder treatment team?
The center of the treatment team for an eating disorder is obviously the patient and her family. Around that care will be several professionals from different disciplines. The first of which is going to be obviously the primary care physician, who is oftentimes the person who identifies the eating disorder to start. That can be a pediatrician, an internal medicine doctor, a family doctor who works with the family and the patient to get them to the right level of care. And we'll talk about level of care in a minute. In addition to that physician, obviously there is then a therapist, potentially a psychiatrist, a nutritionist, and perhaps a family therapist, depending on the other issues that are going on and whether or not the person is an adult or an adolescent. If you are interested in trying to ascertain the right level of care for a patient, and you're not an expert in eating disorders, I highly recommend that you send your patient for an evaluation with someone who is able to. There are criteria, they're called the American Psychiatric Association Guidelines for the treatment of eating disorders, that can be used to determine what is the right level of care depending on the symptoms. And that is really best done in the office of an eating disorder specialist. Just to give you an overview of the types of levels of care that might be available to a patient. We're talking individual or family therapy, again, depending on an adult or an adolescent, and that there are increasing levels of care if those lower levels are not effective in helping the patient gain control of the eating disorder. If the individual or family therapy is not effective, we have something called the intensive outpatient programming. That's treatment that runs 3 to 5 days a week for 3 hours at a time. An eating disorder specific intensive outpatient program would involve eating meals as part of the treatment. If IOP is not sufficient, the next level of care is day treatment, which runs anywhere from 5 to 7 days a week for 6 hours a day. The patient can do that sort of treatment while still living at home. But unfortunately, if those levels of care are not sufficient, the patient may need to go somewhere that is specifically focused on eating disorders and can manage the environment as well as the therapy. And those would include an inpatient treatment, which these days are usually fairly short, 2 to 4 weeks, sometimes even as short as a few days, which the focus is medical stability, and then residential treatment for a longer-term live-away option for patients who have not gotten better with the lower levels of care.
Can you discuss the empirically founded treatments for adult clients with eating disorders and how they've been shown to be effective?
Sure. And remember, we're talking about adults here. Thank you for underscoring that, because when we talk about adolescents, the treatments are different. But when we talk about adults, the most empirically founded treatment for patients with bulimia nervosa in particular, and binge eating disorder, is cognitive behavioral therapy. Now, there is a certain kind of cognitive behavioral therapy that is specific for patients with eating disorders, and that treatment has been shown in over 20 clinical trials, randomized treatment trials, to be the most effective. We are less good at knowing what works for patients with anorexia nervosa, and the jury is really still out on what will rise as the best treatment for a patient with anorexia. That being said, we do know that a patient with anorexia can't get better without eating more and gaining weight, just by definition. There is another treatment called interpersonal psychotherapy that seems to also be effective for patients with bulimia and for binge eating disorder. And finally, there seems to be some new data, and some of which is coming out of our center, to suggest that dialectical behavior therapy also can be effective for patients with bulimia and for binge eating disorder.
Thank you, Dr. Wisniewski. This wraps up our three-part video blogging series. We hope you found it to be educational and useful for your practice. You can find this video series and additional resources on our website at www.eatingdisorderscleveland.org.